Hi everyone, welcome to Umatilla County Public Health's Naloxone training presentation. My name is Carrie Tours and I am a public health education specialist. If you're watching this video, it means that you either have or will be receiving naloxone. So I first want to say thank you for doing that, and I hope this presentation and the following video will help you feel more comfortable with giving naloxone if the event arises. The purpose of this video is to provide education so that you can recognize the importance of carrying naloxone, also to identify the signs of an opioid overdose, and to help you feel more comfortable with administering naloxone rather than prior to this presentation. This presentation will cover some statistics both nationally and locally, what naloxone is and how it works in the brain, the importance of having naloxone on hand, signs of an opioid overdose, and how to administer naloxone. So let's get started. May be using the words naloxone and Narcan interchangeably. Naloxone and Narcan are the same thing, so think of it as naloxone is the generic name, and Narcan is the brand name. The naloxone that you will receive will have the name Narcan on the box and also on the dispensing devices as well. So just so you know, naloxone and Narcan are the same thing. By now, you have most likely heard the term the opioid crisis or opioid epidemic. In the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioid pain relievers, and healthcare providers began to prescribe them at greater rates. Increased prescription of opioid medications led to widespread misuse of both prescription and non prescription opioids before it became clear that these medications would indeed be highly addictive. On the slide, we have a few facts about the opioid crisis, both locally and nationally. So, Oregon is sixth nationally for the non medical use of pain relievers. That can also be read that Oregon is sixth nationally for the abuse of prescription pain relievers. Oregon also leads the country in seniors being hospitalized for prescription opioids. Death rates from drug overdoses in rural areas now outpace the rate in large metropolitan areas, which historically has not been the case. And according to the National Institute of Health, about 75% of new heroin users start by abusing prescription opioids. The map on your screen is a pain reliever misuse in the past year among youths aged 12 to 17 for the years 2016 and 2017. As you can see, Oregon is in the highest percentage of use, or in the highest bracket for a percentage of youth abusing pain relievers. Um, so as you can see, there's not that many states in that high range. So hopefully we can all work to help bring that percentage down. So we have some recent local data from the 2019 Oregon Healthy Teens Survey shows that 9.3% of Umatilla County eighth graders have used prescription drugs without doctor's order in the past 30 days, whereas 4.5% of 11th graders use prescription drugs without doctor's orders. We know that there have been instances of young students having prescriptions that do not belong to them to school throughout the county and throughout the state. Now we're going to move along into the meat and potatoes of our presentation and discuss what naloxone or Narcan is. So naloxone is the life-saving antidote to an opioid overdose. It is non-abusive and non-habit forming. It is completely safe. I could give it to myself and nothing would happen because I'm not experiencing an opioid overdose. It also will not hurt someone who doesn't have opioids in their systems. So it does not have an effect on someone who does not have opioids in their system. It usually works in about 3 minutes and can last for about 30 to 90 minutes. So this is an important piece to know because if somebody has taken a lot of prescription pain relievers or is using illicit drugs such as heroin or fentanyl that are very potent, it is possible for after the naloxone to wear off, it is possible for that person to go back into an overdose. Hopefully, by this time, they are at the hospital and out of your care. But that is definitely something to keep in the back of your mind as well. Hypersensitivity, such as rash, worsening difficulty breathing, or anxiety, is very rare. There's no real documentation of allergies related to naloxone. Again, it's safe. The shelf life is about 18 months. Um, a few other things. This naloxone will not work on other drugs such as alcohol or benzodiazepines, which are antidepressants. It also will not work on meth or cocaine. Another important piece is that um, the 4 milligram dose that you see on your screen is exactly what you're going to be getting. And no matter the size or the age of the person, you're always going to give the full dose. Okay. So it doesn't matter if it's, a very small person or, a very large person or an elderly person. Always give the full dose. You don't need to worry about the size or anything like that. Always give the full dose. Slide shows how naloxone works in the brain. As you can see, the naloxone is depicted by the green balls, whereas the opioid, whether it's prescription or illicit, is depicted by the orange circle. And as you can see, during an opioid overdose, the opioids are drawn to the opioid receptors, and naloxone will actually come in and kick the opioids out of the receptors and sit there so that the brain doesn't get overloaded with opioids. For anyone who has ever seen a reversal of an overdose. So if somebody has given somebody naloxone, they kind of look like they're coming back to life, and that is because their brain is kind of coming back online after experiencing an overdose. So now we're going to move on to why it's important to have naloxone. It can be used in many different situations, so such as accidental overdose victims, whether that's maybe children or elderly. Those suffering from a substance use disorder, I would recommend anybody who has a friend or family member who is in recovery or who is currently struggling with a substance use disorder to have some on hand. Also, it can be used on colleagues, and also if you carry it yourself, let your colleagues know that, hey, I have this. And it can also be used on animals, so such as canine units. So this presentation is also for law enforcement who maybe have canine units. So just so you know, naloxone will also work on canine units, and you can also give them the full dose. Professionally, if you are a teacher, you might be the first point of contact if somebody brings something to school that they shouldn't. Also, coaches, it might be a good idea to have this on hand. Students get injured, especially if you're traveling away from home, might be a good idea to have some on the bus or have some in a first aid kit. And also personally, to protect yourself and to protect your loved ones. So, protecting yourself, I mentioned, if your colleague carries it, or if you carry it, let your colleagues know, say, hey, like, here are the signs of an opioid overdose. If you see me experiencing this, here's my Narcan, and please use this on me. And also protect your loved ones. As I mentioned before, anybody who has a friend or family member struggling with a substance use disorder or they are in recovery, it's a good thing to have on hand because relapses can happen. Oregon's Good Samaritan Law. Narcan is covered under the Good Samaritan Law, which refers to an individual providing an aid, such as a medically trained person, training you have experience in, so like first aid class or CPR. This also protects those who call EMS, including minors. So, for instance, if somebody is illegally using a drug and they are witnessing an overdose, that person can call um, law enforcement and say, hey, my so and so is overdosing and we need help out here. That person does not have to worry about going to jail because of the situation that they're in because they want to save their friend. So it protects different groups of people. I also want to mention in Oregon that legally you do not have to have training in order to give naloxone. However, you are still um, covered under Oregon's Good Samaritan law. So, some of the signs and symptoms that may indicate an overdose are unusual sleepiness or not being able to waken. Breathing will be slow or absent, slow heartbeat or blood pressure, skin feels cold and clammy, pupils are tiny, and nails and lips are blue. Do not administer naloxone to someone who is conscious, so do not administer this to someone who is walking and talking. You do not need to be afraid to administer. This will not harm someone who is not experiencing an overdose. So if you happen to come across someone and you're not sure whether it's a heart attack or a drug overdose, you can go ahead and start, your CPR if you're trained and you're comfortable. And it doesn't hurt to give naloxone, because if it works and it's great, and if not, it's not going to harm the person. As mentioned before, naloxone is non-habit forming, non-abusive. You can't overdose on it. So you can give this to anybody of any size, um, just to be sure. Rather be safe than sorry. So here at UCO Health, we are trying to collect data, not only um, about our naloxone, but where it's going. So we have a naloxone administration tracking form that's available in a fillable PDF or as a hard copy. We request that if you do administer naloxone to fill one of these forms out and either email, mail, or fax us the form. It can also be done anonymously if you prefer. We will not be sharing detailed information to the public, and this is also a great reminder for both you and myself to restock your naloxone, which we can also provide. So now is a great time to head over to YouTube and take a look at the naloxone training video that Reverse Overdose Oregon and the Oregon Health Authority has worked on. You can go ahead and skip to about 1 minute and 15 seconds to get right to the training part of the video. And if you have any questions, please let me know. Say thank you so much for listening to this presentation. I am more than happy to answer any questions that you have. Please feel free to contact me. My information is on the screen. That is my direct phone number that you can reach me at. Also, please leave a message if I'm not at my desk. You can also feel free to email me at carrie.tours@umatilla.county.net, and I would be more than happy to help any way that I can. I hope you all have a wonderful day. Thanks.